So today we are presenting Mask, a New Way of Segregation. We are the Masketeers, and I'm Maddie.
I'm
Sarah.
Nate.
And I'm Alexa.
Why isn't it moving? There we go. Okay, this is not my slide.
Okay, so our research question is, how do people perceive others who do wear a mask in public post-COVID? So on March 11th, 2020, COVID-19 was declared a global pandemic as cases were severely increasing. And as a result, several countries entered a lockdown. So essential employees such as healthcare providers, grocery store clerks, and delivery personnel continued their jobs in a faulty economy, but several individuals began working from home for an extended period of time. And it's a crucial necessity, and it's enforced for individuals to wear a face mask in public to prevent the transmission of COVID. But several people have a problem with this. But why would people have a problem with wearing a simple piece of fabric over their nose and mouth to prevent the spread of a deadly disease? These findings suggest that the psychological effects of mask wearing causes this controversy.
All right, so now we have a little video to watch.
The reason we want you to wear a mask is to protect you, sure. But the main reason we want you to wear a mask is to protect me from you and the particles from your respiratory system from getting into my respiratory system. Here's a scarf. It blocks the movement of air around my throat. It can block the movement of air, but only to a certain extent. This is a homemade face mask. It has just 2 layers of cloth.
Bill Nye the Science Guy. Bill Nye the Science Guy.
Everybody, this is a matter literally of life and death.
All right, so that was our little video. And now we'll move on.
What do we really know about?
Hey squad, get your mask on. Gotta do your pop and make it fast.
Sorry, guys. I don't know what that was.
Okay, so what do we really know about the coronavirus? So far, we know that the loss of smell, along with the loss of the sense of taste, are 2 of the earliest symptoms of the virus. And we also know that the virus is spread through tiny respiratory droplets from the nose and the mouth. And when an infected person sneezes, coughs, or even talks, that those droplets are spread throughout the environment. Finally, we know that wearing a face mask decreases the spread of the virus because it limits the amount of respiratory droplets and gets released into the atmosphere. There is no knowing if you are infected since the virus has a 2-week incubation period, and therefore, to be safe, wearing a mask at all times would ensure that you are protecting others as well.
Okay, so there's still a lot that we do not know about the coronavirus. So some things we came up with was, when will the virus stop affecting our daily lives? Number 2 is, although there is a lot of research done on COVID, it is still not clear why some people show symptoms and other people do not. Another thing we still don't know is, what is the timeline for COVID vaccines and treatments? How long? No, the long-term impacts of COVID on the body. And we also don't know how long people are infectious and if they can be reinfected right away. And these are all very important things that we don't know, and I'm pretty sure that everybody's wondering the same things.
So the incidence of coronavirus distribution This is an article or a report that was done for the Asian Pacific Policy and Planning Council, also known as the A3PCON, and for the Chinese of Affirmative Action, the CAA, and they received over 1,000 reports in the first week. Here are two of the quotes from the reports. So the first quote was by a man. I had worn a face mask on BART to work. There are about 5 Black African teenagers saying I have the coronavirus and used backpacks to hit me. It was a case of physical violence. The second quote we have is from a lady. I was laid off shortly after this incident at Young Yoga Studio, and I was wearing a mask as a precautionary measure. I was washing my hands and these 2 white women kept staring at me and then proceeded to ask where their families should buy groceries because us Chinese people have ruined Irvine. And how it was ridiculous that we still show up to yoga class and how we are so dirty, etc. They were complaining about how Chinese people have infected Orange County and how their families just moved here and that it was a mistake to let us into their neighborhoods associating Asians with garbage. This was bad treatment in the workplace. So as you can see in this chart, from the rise of the coronavirus, face masks have now become one of the leading reasons for discrimination, even above gender. Connecting the article to the class, the social cognitive perspective finds that people often learn behaviors through conditioning or imitating others. And these forms of discrimination could be learned from people who don't understand reasons to wear masks. Also on the topic of stress, considering the stressful and tough times we're in, the stress plays a big part in this discrimination.
All right, so this article was called Social and Behavioral Consequences of Mask Policies During the COVID-19 Pandemic. So this is a study done on about 7,000 Germans instead of in the US. They wanted to, the purpose of the study was to understand why certain policies worked over others. And what they did found that with the 7,000 Germans, that they found that the mandatory policy actually worked a lot better and it was more effective than the voluntary policy. And how they found this was by doing weekly surveys from April 14th to May 26th in 2020. And they measured the percent of people wearing a mask every day and like how often they did that. And they also measured how many people wore a mask in addition to, washing their hands and using hand sanitizer and all those other things to protect themselves. And what this kind of showed was a bit of self-determination. The scientists and psychologists studying this noticed that people were not able to make themselves wear a mask, but when it was considered mandatory, they were fully able to do so. So it wasn't the fact that, they just didn't feel like it. They just, didn't want to be excluded almost. So same thing with peer influence. They did not want to be the odd man out during the voluntary policy. So if they were like the only few people wearing a mask, they were like, we look different, so I don't want that to happen. But when it was mandatory and they were the only ones without a mask, they're like, well, I'm going to fit in, so I'm going to wear a mask. And a social part of that is a social contract. And what the psychologists found were that people were very motivated to wear and willing to wear a mask when told to do so by a mandatory policy. So they are not like, people tend to control, but in this situation, people prefer people telling them what to do and, wearing a mask instead of having to make that choice themselves, because sometimes they don't know if I should wear a mask or not wear a mask. So in this situation, it was easier and more effective for everyone to have a mandatory policy in order for everyone to be wearing a mask.
All right, so the third article is called The Physiological and Psychological Impacts of Mask Wearing. And this article was pretty much an analysis of a bunch of studies conducted into one. And the purpose of this study was to figure out the psychological impact of wearing masks in the pandemic. as it relates to an individual's willingness to comply with mask wearing, because as we know, masks are perceived as uncomfortable and wearing them is an inconvenience, which can lead to people not complying with the mask mandates. And as we know, face coverings are not designed to protect the mask wearer, but rather to protect the people within close proximity of the wearer. And the guiding theory for this research was that face masks, in addition to physical distancing, decreases the transmission of the COVID-19 virus.
Okay, so we looked at a study where they questioned if there was any changes to respiration while wearing a mask. And in the study we looked at, they wanted to see the impact of wearing an N95 respirator. This study used healthy adult healthcare workers while walking slowly on a treadmill for an hour. The study showed that the hour of walking on the treadmill while wearing a mask did not affect respiratory rate, tidal volume, or total ventilation. This suggests that the N95 respirators do not change breathing patterns during low intensity physical activity. Researchers concluded that the changes were very minor and most people would not be able to perceive these changes in breathing. Another thing we questioned was, are there any changes to oxygen delivery in the blood while wearing a mask? A study we also looked at supported that wearing a medical grade mask doesn't appear to impact blood oxygen or carbon dioxide concentrations. Overall, these studies demonstrated that there may be a minor increase in breathing resistance while wearing a mask, but it doesn't impact the frequency of breaths.
Okay, so connecting to the class, so what can explain this? This pretty much leaves the only option left are the psychological effects of mask wearing lead people to not comply with the mandates. So for developmental psychology, specifically from the personality branch, self-determination theory pretty much states the fundamental needs for well-being as autonomy, psychological relatedness, and competence. And while mask wearing fulfills these needs, it can also violate them by impacting perceptions of freedom if people don't have a choice of wearing masks, which leads to psychological reactance and negative responses to mandates. So these diminished feelings of autonomy may be what is leading to negative attitudes towards mask wearing rather than any actual physiological effects. And as for social psychology, in groups, pretty much the us versus them mentality is created and enhances behavior because people feel like the value of their group is threatened. For example, one's political party provides an important need to belong, which leads to strong party favoritism and conformity to group norms. So if one pertains to a political party where mask wearing is enforced and they see it as a good thing, therefore more people are going to be more likely to do that to feel socially connected to others, known as relatedness. Yeah. Okay, so for our future studies, what research that needs to be conducted needs to focus on how can we encourage the better adoption of mask usage and perceive these perceptions of discomfort, because as we've seen, there are no actual really bad physiological effects of mask wearing. And this all needs to be guided towards controlling and eliminating COVID-19.
Future research also needs to shed light on the effective public health programs that can maximize the mask usage based on the public understanding of its effectiveness. So if you want a big impact, you should wear a mask to protect not only yourself, but everyone else around you. Thank you so much for listening. I hope you enjoyed our presentation.